The next question, the member for Don Valley North.
Thank you, Speaker. My question is for the Associate Minister of Mental Health. Speaker, with deep concern, I want to draw attention for the City of Toronto's application to Health Canada to decriminalize drugs for personal use. The drugs we are talking about here, shockingly, include dangerous opioids such as heroin, fentanyl, and cocaine. Speaker, we know we are in the midst of an opioid crisis. The experience in BC and Oregon shows that this approach is a total failure, as the overdose deaths spiked high, as well as the street disorder and public safety concern. My constituents are deeply disturbed that the city is pursuing this action. Speaker, can the Minister explain what is the government doing to address this issue? Thank you, Speaker.
The Associate Minister of Mental Health and Addictions.
Thank you, Mr. Speaker, and thank you to the member opposite for that important question. The Premier last week was very clear. We do not support Toronto's application. As the member rightly noted, the jurisdictions that have attempted decriminalization, both here in Canada and internationally, are in full retreat from the policy because it does not work. I also want to point out, Mr. Speaker, that what Toronto requested was even more extreme, I'd say bizarre, than what they had in BC. The Medical Officer of Health's proposal is to decriminalize the possession of any drug in any quantity, and are you ready, for people of any age, and that includes children. This is known as the Made in Toronto solution. I think it's more like the Made in Toronto disaster waiting to happen. It's a completely reckless plan that would damage public safety, wouldn't accomplish anything to help those struggling with addiction, and is not supported by this government. Mr.
Thank you. Thank you. The supplementary question.
Thank you, Speaker, and thanks to the Minister for his comments. Speaker, my constituents are so relieved to see Ottawa's approval on BC's request for a ban on public drug use. BC Premier said, and I quote, "Keeping people safe is our highest priority, while we are caring and compassionate for those struggling with addiction. We do not accept street disorder that makes community feel unsafe." End quote. Speaker, I agree with Premier Ford's comment. To give them treatment and support is the right thing to do. Speaker, my follow-up question is, can the Minister tell Ontarians what is this government's plan to help those who are struggling with addiction? Thank you, Speaker.
The Associate Minister of Mental Health and Addiction.
Thank you, Mr. Speaker. Once again, our approach is very, very clear. It's treatment, it's recovery, and it's prevention. In partnership with the incredible mental health and addictions organizations that are here today, we're making targeted, data-driven investments to build a recovery-oriented continuum of care. As a government and as a sector, we are aligned. We're going to meet people where they are, but we're not going to let them stay there. We're going to help them get to where they can be. We're opening new treatment beds, Mr. Speaker, in communities across the province, including in places like the North, where they were ignored for years and years under previous governments. We're also standing up new mobile crisis intervention teams, like the one that was announced yesterday in Lambton County. And we're also standing up, Mr. Speaker, to do what is correct for the people of the province of Ontario by looking after mental health and addictions and taking the issue seriously. We will not leave people where they are. We're going to help them be the best they can be. Thank you.